supportive psychotherapy or psychoeducation. One of them will do exams in it. And that shows everybody is in general, at least we can do psychological first aid or intervene when necessary at any level. Then people would spend extra time mastering two, then spend a full year or thereabouts on their own area where they really want to spend the rest of their lives in. That way, people would be able to do two general supportive psychotherapy or psychoeducation, and they'll do one other one to a certain level, then do a mastery level in the particular one they're interested in. So today we just, and like you all know, something like this behavioral activation therapy can take 3 months of didactic lectures if it's just once a week as we're doing. And one will spend a whole year mastering it to a level of expertise. So today we'll just have an introductory discussion led by Dr. Tajudeen Abiola on an introduction to behavioral activation therapy. Like we know, at the end of the lecture, we'll place the recording on the chat group, and people who've missed it, people who are busy, or people who've not been able to do everything during this would be able to catch up and also participate in the discussions that would go on. The discussions will go on for a whole week. So people who have questions can put the questions on the group and then we discuss them together. So Dr. Abiola, thanks, and over to you.
Good morning, Prof. Good morning, everyone. Thank you very much, always. Uh, like you have introduced, sir, that today we'll be doing introduction to behavioral activation therapy. Um, these are the objectives of this introductory lecture to give us a definition of what behavioral activation therapy is, which is BAT, but to explain the theoretical underpinnings of it, to describe the core components and techniques utilized by behavioral activation therapy and that will be used by a behavioral activation therapist, and to discuss the evidence based supporting it. This we may leave because the evidence is overwhelming. So, but and also to address practical implementation and ethical considerations. The ethical considerations have been discussed earlier on, and also a promise has been made that at a point a more in-depth ethical discussion will take place. So this lecture will be silent about that aspect, but it's foretold that for everybody who is a clinician, he must have sworn an oath and uh, at least have acquired some level of understanding and learning in ethical, medical ethics or health-related ethics as it's relevant to the field of practice that each or anyone might be involved in. So that would be about that. So the definition: behavioral activation therapy is a structured, evidence-based psychotherapy for some mental health conditions. It has been used robustly in depression, which is where it first started. Then it has application in anxiety disorders, PTSD inclusive. Some of it has been also have application of substance use disorders, some aspect of it, and there's also eating disorders. There are evidence for all this. Behavioral activation therapy focuses on increasing engagement in valued activity to improve mood. If in, I'm sure with time, the lecture on introduction to cognitive behavioral therapy will be given, and the rational emotive behavior therapy given. While those encompass bring about the aspect of mood into it, the thought, the feeling, and the behavior. The behavioral activation focuses more on the behavior, and it's looking at it that it is by doing those valued behavior, practicing and engaging in those valued behavior, that's what will bring about the improvement in mood. So it's not directly targeting the moods, the feelings of people, but it's looking at activities that people will engage in that will bring about healing for the individual along the line. And this will be part of the paradigm in behavioral activation therapy comprehensively. And that has been part of what as champion behaviorism. Ultimately, uh, behavioral activation therapy is based on the principles that changes in behavior can lead to changes in mood, and this has served as the main model of how behavioral activation therapy take place. And it is based on this that we understand that mental health conditions that often leads to reduced activities and social withdrawal. We know depression is very notorious for this. In some instances, some of the anxiety disorder, substance use disorder, they do contribute to it, and eating disorder, they do limit activity in individuals. And these activities are also essential to life. We have read about the role of exercise in promoting health and well-being. So behavioral activation will help to give the individual the needed tools for the individual to engage in those goal-directed valued activities so that the individual can get well. So, and based on this, it operates and embraces those principles in behaviorism, like positive reinforcement and others, and so that which are usually what were affected in when somebody is going through such illness. Those things are usually reduced. So, behavioral activation help to bring and push the individual forward so that the individual can reverse the cycle of the illness and increase the activity so that it can lead to positive reinforcement for the individual and improve their well-being. Behavioral activation aims to break this cycle of inactivity, social withdrawal, and negative thoughts because of the basic thing which I've described earlier, which is the behavioral avoidance. So it tries to see that people get engaged in those essential behaviors so that the individual can get the benefit and get well. So, and that way, behavioral education gradually help the individual to approach and overcome this avoidance behavior. And a note is that behavioral activation is not about thinking positively; it's about doing positive to feel better. That is taking action even when you don't feel like doing it, with the expectation that the action itself will lead to improved mood. What are the core behavioral principles in behavioral activation? We in behaviorism, all those things are essential, and all these are being used and applied in behavioral activation, and that includes the the most basic, which is classical conditioning. And from classical conditioning, we know from the work of Ivan Pavlov that help us to know that learning, which is the paradigm that take place in behaviorism, that it is by associating an event with a stimulus in the individual that bring about learning process for the individual. So for the learning to take place, a neutral stimuli is usually associated with a meaningful stimuli. So that classical conditioning starts and bring about one of those basic evidence that we have for behaviorism. And from there, we also move to the operant conditioning, where you look at learning is not just by association, but because of a consequence of what is going to happen. And it is that consequence that bring about learning in this situation. And then they bring about the concept of reinforcement and punishment and other related phenomena where we talk about rate and ratio intervals that of how the consequences is being meted out, whether in terms of reward or in terms of punishment for the individual to engage more in that particular activity, whether it is enjoyable or otherwise. So, but the operant conditioning works on that. And for the two, behavioral activation lean on this to the classical conditioning by linking that it helps us to reassociate previously avoided situation with positive experience so that to reduce avoidance. While in operant conditioning, it helps to increase adaptive behavior by reinforcing them, and that way it helps us to keep doing what is needed so that we can continue to be healthy. Well, another principle in behavior is in stimulus control, which is where we modify the environment to influence behavior by altering the cues or the triggers. And I'm sure this is one of the core things that people who specialize in addiction medicine, that they will be able to talk more about this and how this play a role And it is by doing the necessary thing that you can help the individual to manage the cue and be able to modify the triggers so that the individual can stay ahead and be able to stay at the place of better self control, and so that the temptation will not push the individual to do what he doesn't needs to do, so as not to continue to be sick and engage in activity that bring the illness. Behavioral activation therapy help to find a way to adjust the surrounding of the individual, and that way so that they can promote the desired behavior. Such as, that's one of those things that we often use in when we talk of sleep hygiene, or you say the bed should be used mainly for sleep or for sex, but the bed should not be used for other activities. So you don't use it to watch television, you don't use it to play your iPad, you don't use, so all those things are stimulus control, trying to adjust the environment so that the individual can achieve the goal, the desired goal that is necessary for the individual to achieve. And one of the main things that people that might have done one thing or other behavioral activation that is often talked about is functional analysis. And that's also one of those things in behaviorism that talk about looking at antecedents. And by looking at the antecedents, what the antecedent, how the behavior it brings, and the consequences, to understand the behavior pattern of the individual. So in this way, it gave us a two by three, two by four, two by five, depending on the complexity of the function analysis, so that we can look at what are the predating events, what are that's the triggers, and what are the behavior that we noted, what are the consequences that are taking place, and what are those things that ramify those consequences, and what behavioral thing that can be done in order to start engaging to reverse the consequence of that pattern that has been noted. So, function analysis is one of those core skills and very essential for one to know in order to be able to do behavioral activation. And how it is utilized, especially in depression, it helps us to be able to identify those things that are maintaining behaviors that are maintaining or sustaining the depression. And that way, it helps to develop targeted behavioral intervention to those things so that we can reverse it. And if obey those principles that we also know that behaviorism use, that means in other behavioral interventions like systematic desensitization, graded activities. So all those are integrated into behavioral activation therapy. And this just to give us the overview of those founding principles that behavioral activation lean upon. And behavioral activation is usually looked at as the third generation in behaviorism. That they look at the first generation of behaviorism to be the radical behaviorism, where they focus on observable behavior and environmental influences. Of course, but also apply some of these and look at how it can emphasize the direct behavioral changes that reinforcement can promote, and that can bring about introspection. But it also goes to the second generation. When the cognitive revolution comes, people were talking about just the thinking. They will talk of mind over behavior, mind over mood, mind over everything. But it's also find out that when you change how what the individual thinks about, then there is, as a consequence, behavior follows, because the individual is not interested in the behavior primarily, but behavior follows. And that's one of the things that leads to the integration of behavior CBT, that make cognitive therapy to be easily integrated to with behaviorism as one of those compound therapy that one can. And it is based on that that the second generational look also, if we influence the behavior of the individual without bothering about what the thinking challenges are, then you also expect that there will be a trickle pack effect that will also help to start modifying the thoughts of the individual. And that is how it have a reverse effect on the feelings and the thought of individual. So and that way it acknowledges that there may be what people thinks about, what people feel about, and that yes, we can improve your mood, but this will not be by trying to modify or manipulate the thought and the mood, but by modifying and manipulating the behavior of the individual to bring about the well-being. And It's recognized behavioral activity as the third generation because it actually link about integrating acceptance, mindfulness, and values into what it's doing. And that's one of the essential thing about behavioral activation therapy. The value-based system of the individual is utilized in helping to see that the individual can use his productive values to be able to incorporate it into what he needs to do so that to make it easier for them that to keep doing that behavior that brings healing along the life of the individual. So in essence, behavioral activation incorporate values clarification to motivate engagement in meaningful activities despite the low mood. So this is just to tell us that behavioral activation as a therapy is one of those therapy from behaviorism school of thought, but the behaviorism is also in generations from the first to the second and is leaning upon the third generation. And that is why it's one of those essential treatment therapy that if you know it goes a long way to help in individual to get well too. The implication of understanding these theoretical foundations are the focus on action. And this, by definition, means that we believe that behavioral change leads to cognitive and emotional change. And this is what behavioral activation therapy targets behavior first. So that when the behavior is targeted, then this will lead to change in mood, change in thought, and the activities will be sustained along the line. Also,
Oh,
we also look at it when we look in terms of environmental context. And this, by definition, is saying that the recognition that behavior is shaped by external factors. So, behavioral activation try to look at what intervention needs to be modified for the behavior of the individual and the environmental triggers that surround the individual that the individual interact with. The reciprocal relationship between the individual and its environment based on the environmental context that behavioral activation look at so that it modifies elements within this so that to help the individual. So it can look at social cues in the environment. It can look at routines of individuals so that that way it can help the individual to modify this to in order to help them not to continue to be ill so that they can continue to be to gain health healing and hopefully sustain the well-being. Then it's also one of the paradigm about it is that there are
action.
individualized approaches. Sorry, I don't know who is there who can who should help us to mute himself, please. Please, if you are not speaking, you can kindly mute, please. Thank you very much. So, like I'm trying to bring that behavioral activation therapy is individualized. It's not usually carried out in group formats like some of the other therapy as at now. So it's usually carried out in a dyadic process. The therapist and the patient, that is or the client or whatever name we choose to call the person seeking for the treatment. And this is help to tailored therapy to personal goals, value, and circumstance. Behavioral activation therapy customizes activity selection based on patient-specific rewards and barrier. So it's that's how it utilized the individualized approach there. It's also have a lot of empirism in it because it rely on data tracking because the individual life is full of activities and these activities are the data the individual have. So the individual life is full of he has his own big data. Every person have their own big data which is unique to them. And the function analysis help to bring out to be able to harvest this data. And it is based on this. That's why it is an empirical approach. It uses the data in the person's life, and that way the individual can now start looking at let me be and look at this what is happening. I can monitor my moods, monitor my activities, see how all these are playing together through the strategies I'm going to employ and the intervention that have been given for me to utilize from by adopting those strategies. So it utilizes them. And like I said, that based on value, the value system is also a very deep thing about behavioral activation. And because the value is one of the deep things that push us to do what we would do or not to do. So the value can be affected and the individual can continue to be sick. So, and because the meaning that people bring about life, that's one of the area that value works more. So what mother behavior activities is to try to utilize those value to clarify them, which we call value clarification, and to sustain, use that to bring about motivating individuals so that he can continue to engage in this activity, which he needs to do for a long time so that the benefits will come. So it's not immediate reward the person will see because his mood might not change immediately. The thought pattern will not change. But when you are engaged in this activity, you find that it starts to change with time. And that is why the emphasis on the value. So that from the person's data, the value-based system of the individual, then it will be easier to work and the individual will be able to engage because it will be self-directed. That's intrinsic motivation will be activated for the individual to use. What are the core components of behavioral activation therapy? And these are those things that if you understand them, there will be start seeing the tools that when we see it, we can utilize to help people who will be giving this type of therapy. So one of them is activity monitoring. The second is activity scheduling. The third is value clarification. And the fourth most common are problem solving skills. Most psychotherapy involve problem solving skill. Problem solving can also be a therapy, standalone therapy on its own, which has been done, but they all embrace and adapt part of this to be utilized in behavioral activation. So activity monitoring is to increase the awareness of the current activities and their impact on the individual mood. And from this, we can be able to create a baseline. There may be tools we can use, and so many tools are available. And for some of us who have engaged in one research activity or that we know we have so many of those tools we use for research, some of those tools might find way and might be helpful in monitoring the activity of the individual. So some might play a role there based on our expertise in psychometry that will go a long way for us to be able to find the right tool to be able to use to monitor activity. And it is from this that the patient can be able to do daily logging or weekly logging or interval logging and looking at time and duration, the enjoyment, the mastery rating of it. And there are some apps that may also be used these days. And most of the digital generation, they're already aware of that. There are digital diaries, there are digital logins. So there are many things that can be utilized so that in order to be able to put in this and utilize it to help the individual to stay functional. An example of activity monitoring is to ask the patient to log how the individual spend 4 hours scrolling social media daily, noting the mood that's associated with that. Is the mood there, the low mood the individual that's rating it from a scale of 0 to 10. That 0 being that the mood is lowest, 10 being that the individual is having the maximal enjoyment from it. And that way the individual can be able to see, though these 4 hours I've spent, which is a data the person is giving us, that was just engaging in social media activities, is an activity. I don't know how the time flies, but all these hours I've engaged in it. And these are not usually productive activities. And because they are not productive, it also have its own toil. Because when the individual find that there are many things that he should have used that time to do, which are very essential, needed for his own to fulfill his social roles or our social roles. And this time have been wasted, then it will bring about low mood for the individual. And so, and when the low mood comes, the individual want to deal with it, it continue to engage more in that activity, which is so, and this will be able to reveal for the individual what those things are and the behavioral avoidance pattern that engaging in this is creating. So I need that, and the activity monitoring will help to do that. Activity scheduling is to proactively plan enjoyable and meaningful activity that align with the individual's value. So, and this, the therapist and the patient will have to collaborate together to look at it holistically and look at how to create a gradual schedule for that so that they will move from the small to complex. And these are the principles usually used in behavioral therapy from time immemorial. And I'm sure when we remember those some of those common behavioral therapy that it usually talk about in the reading those books about psychotherapy, and it can include carrying out behavioral experiments where you try that if I engage in this behavior, what is it going to look like? What is it not going to look? What is it going to bring about? What is it not going to bring about? How should I carry out the behavior? Which way should I do it? For instance, many people talk about assertiveness, but when some people are trying to teach it, they're actually teaching people aggressiveness, because they say just stand your ground. You have to open your voice very loud. At times, so we are teaching a different thing and we are calling it a different thing. So behavioral experiment will help to demonstrate for us, are we really teaching assertiveness or we are teaching aggressiveness? So from the passiveness that the individual is about those. So we need, so behavioral experiment is one of those things that we'll be able to point it and see whether that thing is going to be carried out outside session in the right way. So that do help, and we grade it gradually. Okay, this is do this small part, this how to do this, I will know whether it's working or whether you do it right or not, and we'll know whether it brings out. So we have to schedule the activities. So and usually the scheduling is from small, from the smallest, from the simplest, to grow gradually to the complex tasks. And for instance, for a depressed patient, then this can include that, okay, most of the time you are find that lying down on bed doing nothing, and so please just take the bull by the horn, make it just stand up, take a 10-minute walk around, and come back. Yeah, 10 minutes is a small time that you can do this. We're not asking you to do a 30-minute jog. We're not asking you to do a 1 hour. Just take a 10-minute walk. And this is starting from the simplest and smallest one. And as the individual is able to do that regularly, then we'll keep increasing and modifying this task so that the individual can engage more in it and get the maximum benefit for it. So that that way, that can help to boost the mood despite the initial resistance the person might have, that can no, I can't do this. Yeah, no, I the way my body is, I'm not going to do it. But we give him the simplest task to do. So when the person do it, it encourages and will reward it, because that's part of what behavioral techniques about reward and punishment. The individual do it, then there'll be a reward for the individual carrying it out, and that help the individual to engage and keep doing and working on that. Another skills that is needed is value clarification. This is how to help the individual to identify what the individual core values are, e.g., their value about their family, the value they hold to their health, to guide the activity selection. So, and this can vary in so many ways. There are many tools to use to measure values. For most people, they will talk about spirituality as part of their value. So, if you have the skill to be able to measure spirituality, to understand it, and be able to work with it, it's fine and okay. But because not everybody is able to work in that line to be culturally compatible with the understanding of spirituality from that individual's perspective. So most of the tools that they usually look at values from the circular perspective. And so some of those questionnaires will be helpful for individual to use to be able to work on this. And this can include exercises like card sorting or questionnaires. And these have been tested and find that when people fill them, it tells us something about their value, and to be able to understand which one are they use often, or which one is higher for them, and which one is lower, and what we can do for the therapist to be able to use this creativity to plan and be able, so, and that way it help the individual, it can help the individual to understand them, and that's why it's called value clarification. So, and that way, a patient can rank creativity maybe as his top value, and from that way, we can use that as one of the or the character strengths of the patient, and we can try to use that to encourage the individual to engage in the scheduled activity, so that that way the individual will not feel unmotivated to do, because the individual already sees my value. So it's not that I must be getting some other rewards to do. No, I will just do it because I felt that this is something I cherish a lot. So that help the individual to do. So that's why value clarification is one of the essential skills that we develop and will be able to utilize to help people then. Another core skills to know is also problem solving. Problem solving is to be able, it helps us to be able to see the barriers, maybe their time, resources of negative thoughts and the likes, so that when we see the barriers, so that is identifying the problem. By identifying the problem, then we brainstorm solutions, and this will and this will be collaboratively work out with the patient. It's not the therapist that will suggest, no, what do you think should be the way to this? Okay, let's suggest three solutions to this. Okay, when we have suggested this solution, which one will be easier to, which one do you think is likely to solve the problem better, which one is less complex from these solutions we have suggested. Okay, let's pick the simplest one that we know is going to work, and okay, let's experiment with how to utilize it, and let's implement it and see how it goes. So that way the individual will walk through the process of that, and from there the individual will be able to understand, if my barrier is I'm too tired to do exercise, but the solution will be, if I feel tired after work, then I will do a 5 minutes of stretch at home. That way, the individual started seeing that, oh, I can still do something about it. And that is starting from the smallest, and those are solutions. So that as the individual do that, then the individual will be able to start employing and applying the more complex solutions suggested. And so, but we won't go to the most complex solution. We'll come to the simpler solution first. And that's problem solving. That's part of what you do. There are many tools that people also use to do problem solving that you can look at, from the simplest to the most complex. So, well, depending on what we know for now, we use that while we keep building our skills and dexterity in that. So all these core components of BAT, we want to look at them at least a bit slightly more, so that it can add some value to this, to what we are talking about. Activity monitoring is the first thing that I talk about. And there are some aspects of activity monitoring when we want to do it. One of them is to do activity logs, which are structured recording of daily activities, and we associate it with mood. This is what I wake up, I don't feel like standing with bed. How do you feel? Rate the mood. Do you need to do that? And we can use our paper, our diary, our mobile app, and digital trackers to do that. And I'm sure most of us we use our smartphones, and some of them do have the Earth app on it that can track our movement around, and that also keeps some records about us, some data about our physical activities. And some of them also provide other things that will be the one logging onto it, and that's why they can we can log more information to it that can help us to know the activities that we're doing and how they are impacting us. An example of of an activity log would be a patient log. Say from 2 p.m. to I took a 30 minute walk. How is my mood? Oh, it's much better. Do I enjoy it? Yeah. So that is now also that after doing the activity that was scheduled, this is what happened afterwards. So the patient will have to do that, and he can use a digital device. Clinically, activity log help us to provide baseline data, and as the individual is there, we have that baseline to compare with, to see as the individual is doing the activity, what are the changes and improvements, so we can have something to compare to know whether the intervention is working or not, whether the intervention is being applied the right way we expect it, so that the person can get well or not. So activity log is one of those core skills in activity monitoring. And also in activity monitoring, it helps us to identify patterns, so that way when we identify power, we can analyze this and now be able to understand how this affects the mood of the individual and the relationship of the individual. So and that way it helps us to be able to understand that, oh, we have data, real data, which are not manufactured data, but these are real data of the individual, which individual did not might not necessarily pay much attention to. But now the individual is now more aware of it, and we can now collaboratively review that with the patient, and that way it will help the person to understand that this is my pattern that is continuing to contribute to why I'm ill, and what do I need to do about it. Then the individual can look at it that way, and from there we can notice some consistent mood improvement when the individual can see that, okay, I've engaged in exercise now, and based on the schedule that I'm doing, my pattern that I've challenged the behavioral avoidance which was there, which I'm doing something to challenge it. It's no longer holding me back, and that way my mood is improving. And so, and the more I exercise, the more I no longer engage with social media, and it allows me to fulfill my social role and to engage in more meaningful activity that's expected of me, and not just to be on the social media while I waste more times when it might not be a useful activity I'm using the social media for as at that time. And one of the clinical applications to help us to identify if the individual is on antidepressant, and to see what the activities of, I mean, the antidepressant activities that the individual engage in, the potential triggers of it, and the individual will be able to do something and work against it. And also through that, we can also identify positive activity highlighting. So that way, because when we take data from people, we will see those pattern that is making them sick. We also see those that are strength for them. And that way, we know we're already having tools we can keep boosting, keep encouraging the individual to engage with so that the individual can get well. And that is to select those that reliably will improve the mood of the individual. And this can include value, those are the value related, value generated things that the individual will do without looking for much reward, without looking for tangible rewards before the person do it. And this can include exercise, and this will be reinforced through so many strategies. And that will allow the individual to prioritize time with grandchildren or reading or music therapy or art therapy. The individual will be able to see, oh, this is where I can utilize this because I have this strength, and by utilizing that strength, I can keep using it to help me do this activity, which I would love to do, but I can't engage with. So, and that way, it the individual can build personalized list of mood boosting activities based on the data we get from the individual. And it is through activity monitoring that we can be able to derive this data, which are related to the individual, and we can from there we can get a data driven scheduling for the individual so that the collected data will be used to plan the therapeutic process for the individual through behavioral experiment, graded tasks, assignments that will be given that will help us to plan better scheduling of how the individual can go about the work, identify places to carry out the work where we do have natural parks around that people can utilize. We can now use our creativity to work what will be similar, what will be healthy and be helpful for the individual. Because okay, if there's an estate that is secure, not far from you, you can move there, then you can do exercise within the estate and so and with the understanding of the people of the estate. So that way we will be able to use our creativity to help to see that we can schedule the activity effectively. And clinically, it helps us to create targeted intervention plan to increase rewarding activity for the individual. Uh, what are those things too? We also look at when we talk of activity scheduling, which is another the second major component of career behavioral activity activation. To schedule activities, these are some of the things that we need to do because by doing them, we'll be able to schedule activity. That's to do a collaborative planning, and this is jointly develop the activity we want the patient to engage in with the patient input. We have to do it with the patient. We don't do it for the patient. And this can include activity monitoring, diary, shared decision making. An example would be to review the activity monitoring diary to replace TV time with previously enjoyed activities. So maybe like calling a friend or calling one's parent, calling one's friend. Uh, so by that, instead of saying, okay, I'll just sit in front of the TV, you know, just pick up the phone call. Say you want to visit them, but you couldn't go now, but still use that time to make a call, talk to them on phone. So that way, you are already, those are part of the scheduled activity, and that will help the individual to do it. And the therapist's role is to provide a guide so that the patient will be able to drive that what has been agreed upon. The therapist will not play the role of a paternalistic individual. So he's not going to be an advisor, but his role will be to be a guide, a collaborator, and to serve more like a coach so that the individual will be able to appreciate what he or she needs to do in activity scheduling. Another core aspect of activity scheduling is values to align with the activities because this is what the patient or the client will prioritize and will find it easier to do. It will come naturally for the individual to do without not getting external motivation. The individual will do it and because there are its values and be able to carry it out. And it is by carrying out value clarification exercises that will help us to understand those values so that we can link up those with to be able to achieve what we look for. So that will work then. And also in the same way, patient valuing will help to create schedules
Yeah. Yeah.
that will be helpful for the patient.
What
Maybe
about
patient loves painting, then the schedule can be created.
well,
Okay, if you used to paint for hours before, but now you don't have this time, just paint for 5 minutes, or even make activities to do your painting activities for 5 minutes or 10 minutes, then take a break. After then you come back to it again. So this way it helps the patient to be able to see that the activities, the value of the individual is aligned with the activities that the person used to do before, and that will help the person to engage with it to boost the mood of the person permanently. And this will focus on pleasure, mastery, or value connection. The graded task initiation is part of what we've done, and that has been one of the value. You start small and you keep increasing the complexity of the task as you go. And those are one of those principles that we use for people who might have helped somebody who has phobia. And these are some of the day where we create the phobic object from the most less phobic to the most phobic of it. Maybe somebody who's afraid of dog, you can bring a picture of a dog. The person might not, but then from there you can start grading the activities until the person will have to stay with a live dog, which not scary. Then later we scary one and testing how the individual engage with it. So those are graded task initiation. And for somebody who might be depressed, might include like, okay, just take a 10 minute walk or go to the gym, just do a 5 minutes activity, or you used to write before you enjoy, but so why not just write a paragraph instead of saying, okay, you want to write a whole book or a whole chapter. So that way you keep building the task the individual needs to do that he felt he has been down from, then the individual started engaging in it gradually. And that way the confidence of the person will be built so that the early success will encourage them that to go the extra miles to be able to achieve that. And one of the activity under activity is so structured scheduling of activities, and this is to integrate activity into the routines of the individual, what the individual must do every day, the individual routine, either daily or weekly. And the weekly planners, the digital tools that they can help the individual to put that, okay, there's a reminder, I've not done this today. And I know, okay, work, I need to go to work. So on the way to work, I need to, when I get to work, because I have some minutes before the work starts, and the individual I need to sit down, I need to give them a call for even it's 1 minute that get for this. So this will be integrated into it, and so it can help us to structure the activity. And that is why the example here is to maybe to fix 8 a.m. I will take a walk. Tuesday I will do social evening, things like that. So, and this helps us to create predictability and accountability for the individual to do. The third core component of behavioral activation skill is value clarification. And this is one of the core components of acceptance and commitment therapy. And doing value clarification, it entails identifying what the core value of the individual is, like recognizing the value neglect, and look at the value aligned activity the individual needs to engage with, and motivation enhancement for the individual in order to carry out those activities. So to identify core values, there are tools that can be used, like the 10 item value inventory, the 20 item. There are many, many different. So, and when this is carried out, then you can discuss with the individual, and they will help the individual to be able to appreciate that, oh, this is a value, these are my strengths, these are the value that I have, which are core strengths. And this will help us to be able to utilize and be able to use that to for the individual to see that yes, you have some strength, and it might the very individual might be related to family, it's the career, the individual well-being, health, creativity, community, spirituality, whichever way it is, it will help the individual to do that. And so that way will help the individual to be able to identify those value strengths he or she has. And by recognizing them, then we can start examining how the illness is affecting or impacting the value of the person, and on the person's life. And through that we need to start having guided reflection, value mood value mapping. And through that activity the individual will be able to now say, oh, I need to normalize my struggle while building my motivation for change. Then the third aspect of value clarification is value aligned activity selection. So that we will choose, we select those activities that will, and that is why behavioral activation, part of the definition is to do those valued aligned activities because they are very essential. Without doing them, then there will be no motivation for the individual to want to engage in those activities. Just like when we have people who are alcoholics and you give them anti-abuse, the sophiram, they will not use it when they know that. But if their value is aligned with why they should take the tablet of disulfiram. So we have to find their values, and when you understand their value, then we can line some of them. So I don't want to drink because of my family. So they find the value of my child, of my this. So that value will be aligned. Okay, that's why you take this because that will help you. Because when you take it, the repercussion will be high. So that will help the individual to boost, and that's why anti-abuse is still one of those behavioral tools that is being used, even though the person is taking a tablet, but it's a behavioral modification for the individual. So that is how the value are aligned to, and that way you can match the value of the individual with the activity the individual needs to do, and we can monitor it. Okay, you need to do this. How is the value helping you to achieve it? And that way it helps to boost what you know. So the person should always remember we start small and focus on action over perfection. We don't say no, you must be perfect now. It's just the action that is important. Every little bit of action taken, like they say, is a drop of water that make the mighty ocean. You don't expect the ocean just to pour out one. So leave that, just keep dropping, making a drop into that activity, into that behavior that needs to form, that will help the individual to get to. So it is those little drops that we're looking at. And that's why some people call it baby steps. So all this is part of what value clarification will help the individual to be able to take those baby steps to achieve what is needed. It's not after perfection, it's about helping the person to do the activity to start getting well. And we motivate the individual, we enhance the motivation by linking the activities to deeper purpose. Value, some people value can be spirituality, and that is where some people's purpose are. Some other people's purpose might lie in some other things, but it is by identifying those their purpose, which are also value lagging. That is where we'll be able to link it together, and that will help them to do more and do better and go the extra mile to do the needful to achieve that. And that will help to keep the motivation going. So that without looking for the external motivation that may not help, just like some people will say, okay, I'm coming to this drug addiction because I've been promised that I'll be giving a brand new car if I come for this. That is not a value linked activity. So that's an external reward linked activities, and that is going to have problem for the individuals to engage with the process of the rehabilitation. So we have to find how we can help them to appreciate the value while in the rehabilitation in order to be able to do better and not to keep his mind only on that external reward. And to give us just a few about one of the things we are so much familiar with, which is the Maslow hierarchy of needs. This list of values have been created, and it is called the value hierarchy pyramid. The value hierarchy pyramid has utilized based on the Maslow hierarchy of needs, has utilized that to look at from the most basic needs, which are survival needs, to belonging, social needs, to growing, which are things that we need to acquire new skills so that we can master some other things to allow us to grow. Then we can start looking what impact can the individual make, and that will come in terms of influence, risk taking, and from there we can see that we get to the level of self actualization. And these days, after self actualization, people also look at beyond that and call about peak experience, so which has been added to the Maslow hierarchy of needs. So all these have been there, and this is just to give us so that if you are looking for a guide about how to help the individual look through their value, so you can have it, and when you have work with the person and you find the value the person hold on to, you look at, is it just at the survival level, is it at the belonging level, is it at the growth level, the impact of fulfillment, because this will also give you what those value will play in order for them to engage with, and what kind of activities may link to link up where you find the value of the individual in order to help them. And I'm sure we know we have all come across this when we have one client or the other. For people who are really struggling with survival, we know how difficult it is to help them. to say that you need to stop this habit of not using substance. You need to do it's they can't just understand it that this is the only time I'm using to cope. So I don't. So it's challenging. So, but by knowing what these are, then we can help them to understand. Okay, your health is very important. Your well-being is very important, and the little help you can get through some social workers' inputs and others, then that may add more value to them, and that will help them to grow their value, and that will be utilized to help them engage with the activity we need them to do, so that that will help their well-being and wellness. The fourth core component of behavioral activation is problem solving. And this is just to give us a view of it. The, to solve a problem, one of the common barriers that people talk about is lack of time to solve the problem. So, and this is very difficult because when you talk to people, you say, "No, I don't have time to do this." So, but if you are able to link it with their value, probably they will create the time. And it is through that way that we'll be able to now look, okay, let's check your day time. Let's look at your that's the time audit from when you wake up, what are the activities that you do to go back to bed. For the whole day, we look at the 24 hours schedule, and that way we can look, oh, this are period. We did not utilize this time, or this time can be used for the what activities we are talking about. So that way the India will not talk about lack of time to do this or that. We will be able to find time that will be, and that's why we are working it together with the person, so that from that way we'll be able to schedule the appointment, make some micro workout, and activity stacking will take place, so that meetings will take and the individual will be able to participate. Some people will talk about transportation issues, and so if they have transportation problem, they can have easy access, they can get to where they need to be on time. Then we can tell them, if you don't have a car, public transportation is there. The if you don't still have this thing, if you have access to internet, then you can utilize that to achieve some of the goals you need to achieve. Or if there's something you can do at home, then you don't need to rush out if you can still achieve the goal of what you need to do, be at home and to like and do the project. Or you find a place that's closer to you. So that's problem that we're trying to solve. Some people may not have social capital that may even provide the social support. So when there's little people in their network of activities, what do they need to do? Then we have to help them create a boarding system that will help them to be able to start finding people that they can be friend with and that can provide help from that process, so that they can help buffer their social deficits, and that way they can keep growing. So there can be a small group of starters, online community, volunteers opportunity, so that that can also lead to friendship. All this can take place there. There can be financial constraints that will take place there. And when there are limited resources, we also want them to look at, okay, you can't go to a gym. If you can go to a gym, what can we do? Let's look for a free workout video. You can watch it and use that as an exercise. You don't need to go to a fanciful gym to do that. You can do some outdoor exercise. You can engage some community programs, body weight exercise. All those can be take place when people give as part of the challenges that serve as a barrier for them to solve a problem. And when there are physical limitations, health conditions, chronic pain, and things like this, then we can also look at there may be need for pain consultation. We need to see how they can help them to get some adaptive equipment and see how the impact that is cost effective, that are not expensive, and the alternative to what then can be utilized, and we can see how we can pace the activity so that the individual can have maximum benefit from this. So this is part of, so essentially to carry out problem solving, these are some of the things to be able to do. Once you identify the barrier, like I've said, we brainstorm. When we brainstorm, then we select the right and we try it, we evaluate it, we adjust it, and we continue to utilize it. That's about problem solving flow chart. It's usually flow that way. But also, when we want to look at the solution we have suggested, we also can create a grid for that. So we look at the solution suggested. Is it easy to do? What is the cost of it? What's the expected benefit? Should I choose it or not? So this will also help us that when we brainstorm solutions, we also grade those solutions. I would, in terms of the ease of it, the costs of doing it, the expected benefits. So that will guide whether we should do this or not for now. These are very vital tools to utilize when you have identified barriers. So that when you identify those barriers, the solutions that will come, we can also grade the solution so that that will help us to choose the right solution earlier. So these are some of the things to note clinically that we should let them know, normalize that some solutions won't work. It is part of life. Because they need to know that they shouldn't say because we suggest this, it must work. If it doesn't work, that's why we don't suggest one solution. We suggested more than usually one solutions. So that way, since we suggested more than one solution, that way the individual will be able to to understand that if one is not working, then the other solution that are suggested will be tried and utilized, and they might work, and that will not make push the individual to giving up situation. And whenever there is some success, we celebrate it, no matter how little. The passion will celebrate it. We let them know this is worth celebrating. We revisit barriers periodically as circumstances change, and we can look because we can let them know now we can't change this, but we revisit it in the future because we might have developed some other skills to be able to now face the barrier now, barrier that nothing we can do about it now. Or circumstances will have changed, things will have changed in the environment too, that barrier will no longer be there, or that barrier might be weak, alternative frame might be available. So those will be looked at. And we have to balance structure with flexibility in implementation. So, what are the techniques for utilizing these tools that we have talked about? And in behavioral activation, the techniques used is to employ behavioral activation. We activate the behavior. We give task assignment. We give reinforcement, and we use shaping. These are typical thing that is being done, and they serve their purpose, their process to do it, and this will work. Behavioral activation, we need to exploit the value, we identify the activities, we schedule it, we provide support and follow through, and we emphasize the experiential learning from it. These are vital. We have talked about tax assignments, which and all those core components will help us to do it. We talk of reinforcement. That's why we start slowly and we give reinforcers, like intangible reinforcers. Not that if you do this, I will give you one chocolate, I will buy. Not necessarily. Reinforcers like praise, self compassion. Okay, we'll work together. Okay, I will drive you to this place to go and watch this. Those intangible reinforcements, they stay longer and the cost of them are heavier than to say, okay, I will give you a monetary money for this. Usually, so the reinforcement, we should work more with the intangible reinforcement rather than the tangible one. That will help to facilitate the process. And shaping will be very helpful, which is one of those cases in operant conditioning, which we start small, we increase incrementally and raise the challenge, and we use self-monitoring to track the progress. So briefly, it's just for us to look at this case so that we can go to the comments from us. The I've tried to look at one of the publication with Professor Dofia that we published together, which is we are trying to make a functional analysis for assessing stress and value challenges among frontline COVID-19 clinicians. This is a study that was carried out during COVID-19. There are about 38 frontline clinicians were seen, doctor, nurses, lab scientists, with people like that. And we just try to see, to do a functional analysis based on the published work so that we can see just to give us a guide in what we're talking about. And from there, the assessment shows that they have identified stressors. Because from the study, we find that there's high mental health body. About 28% of the exhibited depressive symptoms and 34% exhibited high anxiety symptoms. And this tells us that this is some things we can do to identify. We are doing our own functional analysis this way. And we also are looking what are the key contributors to this. And that is where we are looking at their value, the existential crisis that are there, the existential concerns contributed to this because they're looking my fate and dying while doing this, and the emptiness and meaninglessness of life will it be there, and also some other aspect of it, loss of sleep because the demand of working there is so high. So they report high insomnia. So this contributed to the stressors they are going through. And then they also work related stressors because of exposure to likelihood of being infected patient mortality rate is high, pandemic related misinformation there, and there's also stigma that people are also attributed to people that work there. So all these work together and bringing more and more tension. So this is what the functional analysis is trying to do. And also we'll look at the gender. We find that the male, and they are more open to change. The female face other additional role-based stressor because of gender and the way people look at them. That, oh, you are married, you don't come home if you do this. You are too selfish. You don't even consider your family. You don't look at your children. You don't look at your husband. Many things like that. So the female face more jeopardy also in the process. And what are the protective factors we find there? They are all resilient. So a lot of them are resilient. And this shows that the moderate resilience will help them to deal with it. A lot of them have social support. And this already identifying the strength they have that we can utilize to help them get this. And there are a lot of healthy coping mechanisms that these people have that will help them to be able to do the needful. So all this contributed to achieve what we are looking for. So that when we want to help them, we can use those strengths we find to help them. And the study also look at their coping mechanism, the use of mature defenses especially. And they have found some of the mature defenses that most of them utilize, and this can be boosted. And this is helping us to start finding tools you can use, we can boost. And we also look at their value using the TP, the 10 item, I mean, the TV, 10 item virtue inventory to be able to get all this so that we get the strength to boost their moral values and self transcendence. And the functional relationship that when we look at the individual and their coping, we are looking at lower use of this what they call mature defenses is contributory, and the higher existential crisis is also contributory. And this helps us that okay, we can give them activities that will help them to start utilizing sublimation humor better in the place of work. And we can also give them activities based on their values that will help them to start looking at it. They'll know to be afraid is normal, which is normalization of it. But the work I'm doing is also valuable because I'm going to save more lives and I'm going to help more people. And this is also valuable. So that will help them to deal with it. When it comes to the issue of sleep, which also affect their mental health, insomnia is there, which is one of the things that is there. And depression that might also contribute. We also try to look at all this, how this play a role that will be helpful to help guide and help them get well. The intervention plan based on this is to look at it and look at what is the goal of what you want to do is to mitigate stress by enhancing the engagement in value driven activities, which is to improve their coping strategies and reduce avoidance behavior. The core components of what we hope we can plan for them. This is like the behavioral activation intervention from that study that if we are looking for anyone there that we can have a baseline of what to do when they come. We cannot get more data from them, inputs to it. This is just a guide. So we look at it. We want to do, we do activity monitoring. We have talked about tools we can use for that. The value, what we hope to do. Week three, we do the value clarification. And when we use those things, it helps us to be able to understand many things more about them so that we can now use those value to link it with the activities that is valuable so that we schedule the activity that help them to engage in what will help them to deal with the stress of the job, the high demand of the job, and the existential challenges and feelings that come with the job. And that will help us to link with activity scheduling, which will be week 4 to 6, so that that way the behavioral activation make techniques, the processes will take place and we introduce gradual rewarding activities like 15 minutes walk per shift, up enhancement uh, therapy. Uh, so then we also teach about sleep hygiene and what will help them so that the sleep challenges they face will also be dealt with. We also teach them how to deal with existential stress by creating mini journals and what it means for them, how to write it, this is what it means, this is how to interpret it, this is the value that will come from it. So we will look at that and we also problem solve so that we can identify the barriers they have. With time constraints is true for them, the fatigue from the work after a long day work. We look at it so that we can create look at the barrier true problem solution we do so that we can look for how to chunk their tasks into smaller ones. Even while at work, it can achieve some level of physical activity by not just sitting down all the time. You're working, but you can stand up and walk. So you can have a standing bench walk if the individual, and so some of this can be there as part of the solution, but also we need supervision so that that way we collaborate with the supervisor to be able to brainstorm more creative solutions for them in order to rotate and survive well in this high stress duty. The techniques that will be used in order to boost that. We have talked about shaping, reinforcement. We keep providing ongoing support and monitoring, and we have many tools to use. And some of them we talk about, but it's left for us to also improve our tax in psychometry to be able to utilize this. Then we have adjustments if the insomnia persists after doing the earlier activities that we have done, that this is sleep hygiene, this is what to do, these are the rules and don'ts, this is what to do. Then we can bring additional therapy to do like CBT insomnia techniques, which will help to boost that. For people with low social support, to facilitate their body system so that in the place of work, the camaraderie will be improved so that people can have that social support while at work, and that will also help to boost that. And this is how a typical weekly plan will be for them. Okay, on a Monday is a very busy day, but you should be able to have a 10 minute morning stretch. Even if you can't work out, just stretch, stand up, or do fire on the mountain, run at the spot, and things like that, so that it can help to give the individual the exercise that is needed. And also, value address will be self care. On Wednesday, you can have a lunch with a colleague, and that way it provides some exercise, it provides some interaction, and that helps to boost the social engagement that we're looking for. And Friday, we can reflect on one positive work moment, which is the meaning that helps to reflect about self-transcendence, to be able to value and see the value of the work they are doing, so that the existential suffering will reduce and help them to overcome this. So the outcome metrics while we are doing this is for us to be able to see that when we do this over this period, we're expecting there should be a reduction in their stress level from depression and anxiety, and see that there should be a reduction in it. And so we set the targets. We can set a 20%, we can set a 50%, depending on what we have seen with the patient and the client and what will work out, that can be set out. A note for us to do, especially in this particular group, and when we'll be doing something similar like this, is to see that we tailor our intervention to the gender differences, because it's very important, so that we encourage males to leverage openness to change, which they already have, for flexible coping, and while we encourage the female physician to use their potential for structural support, so that they can be able to discuss the challenges they might be facing at home and be able to look for how to address that, how to, when they go back home, how to integrate back with the family and all that, so that they can be able to fulfill their role then. And with whatever plan we see, that we should be able to integrate it with the strengths of this group of people based on the identified strengths, so that we can incorporate it to it and capitalize on to be able to use it to address the stressors. And we should always try to provide regular feedback in order to keep increasing the adaptability of this group of people. Thank you everyone for allowing me to do this, and thank you, Prof. I think this is the end of the. Uh, Thank you very much, sir. Yes, sir. I think it's time for the question and answer session. Thank you, sir.
Yeah, Dr. Abiola,
Yes,
thank
sir.
you very much for the time and energy spent in the lecture. And you've done it within an hour, which makes it beautiful. Like we all know, like our tradition, anybody who has a question should be free to type it or write it. If you are writing, just show your hand so we'll know that there's someone waiting. But before we go on, I think we should all thank Dr. Abiola for an extensive job of doing the presentation. So, luckily, people have said thank you. Some are clapping, some are saying it properly. So, thank you very much for that.
Thank you, sir.
Maybe we ask with a controversial question that has been typed in already by one of the participants. He's written a long, let's see if I can locate it. The person is asking if Nigerians respond to tangible or intangible reinforcement. Please, I believe you've seen the chat. If you've seen that question, maybe you should ask it. You should read it out so that we are sure I've not over paraphrased it. I saw a question. Let's see if I can locate it now and again. Yes, thank you so much for this presentation. Do Nigerian adults clients respond more to intangible motivation than tangible motivation? Please, do we have any study on this? Dr. Biola, you want to try the answer?
Okay, thank you very much, sir.
What's
And it's a very interesting question and a great tools to bring more
tools
discussion about it.
to bring
Of course, in terms of published work in Nigeria, there are scarcity of
there's
published works. However, one of the things I want to point out that, like the research that I
the
cited and I try to use to
and I
illustrate
try to
the application of behavioral activation therapy, that research is also pointing out to what some of the things that will be used as the intangible reward. Because the research is looking at some of the facilitators of the well-being of this frontline uh, uh, of these frontline clinicians. And what that research shows is that a lot of them use mature defenses. And mature defenses, like humor, is a mature defense. So when you know somebody uh, utilize humor for, then you provide more avenue for humor to be available to the individual. And that will be an intangible reward you are giving the individual. So you already know based on the research that this individual utilize this matured coping mechanism. So and creating more avenue for that will help the individual to be able to engage more in the activities that you need. For instance, for people that love humor among this frontliners, okay, you can get one of those stand-up artists, the comedians, and you can get one of their recording artists and say, okay, while you take a walk, listen to this. So you utilize this. You list from beginning to the end to utilize it for your exercise activity. That will encourage the individual to take the walk while listening to the human that is already entangled with. So, and these are indirect, but this I'm just saying that they're indirect data to show that even for adults, intangible evidence, I mean intangible rewards also work, not only tangible rewards. We often look at it that if there are no tangible rewards, people might not do anything, but that's not true. We also know that there are some data that have been published in it that talk about job satisfaction. And job satisfaction has also shown that not everybody link their job satisfaction to the salary they are receiving. And that also shows some of the conclusions that show that there are intangible rewards some people get from their work. Some people, it is the joy of being able to help a patient to overcome their problem. That's an intangible reward that keep helping them to say, I need to go to work. And there are people that needs my service. There are people that will benefit from the service I'm providing for, even when other people don't value me. But for these people that can help, it contributes to it. And those are intangible rewards. There are no tangible pay for it, but the intangible rewards that come from it, they are usually the ones that last longer. And that is why even the research of happiness have come to show the more people provide those intangible outreach to others, the more they contribute to their own capital to be happy. So when people were able to reach out to help others more, not only through the tangible ways, but also through the intangible way, they're also contributing to their wealth and happiness. I hope this that I've talked about in a way I've contributed to provide some of the anecdotal data that are available in the country. But they're indirect, but they have also contributed to show that yes, not all adults in Nigeria are only looking for tangible rewards. There are intangible rewards that are also there, and people do manifest it in their engagement in the activities they do. I hope this contributes to answer part of what is requested in the question. Thank you very much.
Thank you. Thank you very much, Dr. Abiola. Ubo, you want to make any comments on that, or you'd rather do it at the chat group during the week's discussion? Because during the week of discussion, we would all have the opportunity of looking for data, especially in Nigeria and maybe Africa, showing whether blacks respond to tangible. For those who are not familiar with the terms, the person asking the question is probably assuming that Nigerians would respond better to cash reinforcement than semantic reinforcement or other things like Abiola said, providing humor, providing praises and stuff. So even if you don't have more, we will be doing lots of discussions of that during the week. And people will be encouraged to research and present discussions on it during the week. Now, I saw another question. Um, let's see if anybody can. Let me see if I can locate the question. Yes, Ibironke asked, even after explaining how behavior activation works, the number of depressed clients still remains stuck at, I don't feel like doing anything. I don't feel I don't feel the motivation, so I can't start. How can we circumvent this barrier, sir? Then another person asked, Dr. Iabo asked, um, please, how many sessions of the therapy do we anticipate with a client that has drug addiction? So those are the questions. Maybe before Dr. Abiola answers, is there anybody in the group who would feel like responding with to the questions so that Abiola can take a drink? Sorry, can drink water. Is there anybody who wants to tell us how many sessions and what to do when a client you are dealing with is still stuck, like written here in depression? I don't feel like doing anything. I don't feel the motivation, so I can't start.
Are we allowed to speak freely?
Definitely, we're allowed to speak up. Just unmute yourself and speak. Remember to unmute. Sorry, remember to
Okay.
mute when you finish speaking.
Okay. My experience in a drug rehab. First, I want to thank Dr. Biola for the presentation. It was very apt. It was apt. And it was also complex because I was trying to see how to harmonize everything into one big whole. Okay. So thank you so much for the presentation. All right. So my experience in regarding how many sessions if a patient feels stuck is that it depends on where the drug patient is. Is the patient in a protected environment or is coming from home? If he's coming from home, it might be a bit difficult because there are so many external factors that might be difficult to motivate them. But if he's within the facility, you can provide structure whereby he's in quote compelled to carry out certain activities. All right. Now, with regards the number of sessions, it depends on the individual himself. It also depends on if you're able to find the in quote tangible or intangible motivation, uh, 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 um, 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 uh, intangible or tangible motivators for them. That has been my experience. For example, some patients in our facility, we find out that if they do a small thing and you offer them bonds or drink a mineral, if their whole countenance becomes they are so elated, they're so happy. Okay, we cannot do that for patients coming from home who have every single thing. So that is or that has been my experience. Then also it depends on who the patients are working with.
as well as the support at home. When they now leave the facility, wherever they are, what are they expecting at home? Okay, are they expecting nothing? Are they going back to chaos? So these are some things that can influence the motivation. Then lastly, are these patients working hand in hand with other patients, which would serve as accountability partners within the session, within the therapy session. This means that if patients are working hand in hand with others and they would serve as each other's motivation, whereby one of the patients is responsible for ensuring the next one does his or her tasks, or they can now score that the person who motivates the other gets a reward for that. So these are ways or factors that can influence the motivation or the number of sessions offered. Then lastly, if they cannot speak the language, sometimes some behavioral activation methods involves writing, because you need to write to test out the behavioral experiment. You need to write down, okay, this is the plan, because while you're planning for behavioral experiment, you need to make plans to carry it out that week. And if your client is an illiterate or cannot write, it might be very difficult towards implementing. Thank you.
Yeah, thank you very much. Are there any other answers to these questions? Is there any other person who wants to make a comment on it? We have two things: a patient who is fixed, depressed, despite all your efforts to activate behavior, the person is still stuck in the depths of depression. Second question: how many sessions? Let's be brief because we have a few minutes to tidy up. Is there any other comment on them? Maybe I'll complicate the question by wondering, the person who is stuck in the trough of depression, could one offer chemical activation instead of getting stuck himself in behavior activation? So comments are still expected. Do we encourage or pull the person out of psychological restriction by using antidepressants? Well, Dr. Abiola, you may still want to make comments on this if no other person is making comments.
Thank you very much, sir. On the intangible rewards, if I may, that we use them even common in Nigeria, that maybe that we might want to talk about it. For instance, there are times we refer to some colleagues uh, say give them some titles. So okay, yeah, the captain of this place. So and those titles, they're intangible rewards, because we could decide to monetize it and decide that okay, instead of giving this title, I'm going to monetize it. So some of these intangible rewards also work into the treatment facilities. For instance, some of those rehabilitation centers, they also have it that some people might become the leader of the house. That's of the rehabilitation center. That's the patient will become the lead who will serve to lead the house. And this can be rotated weekly. And those are some of the and this can be tied to their performance in the rehabilitation center. That it is based on your role and the performance that you have done. That's why you are going to lead the house for this week. So these are some of the intangible rewards. There are sometimes some nurses that I call mommy. Uh, I'm calling them mommy. It's not because they are your mother, but that's an intangible reward you are giving, and you find that they'll be more receptive to you. They'll be, they'll be more open to work with you than some other doctor who just say, "Hey, man, nurse, bring that folder." They will feel really, really reluctant. So I'm just trying to say that there's some element of the use of intangible rewards in so many ways that we might have used at place of work and in other settings, and this has yielded the result we wanted. We don't want a barrier. We don't want another. And because of those intangible that are being given, the work flows, and that's part of what it. I'm trying to bring there in terms of intangible rewards. Then in terms of rehabilitation, said how long should it last, and an answer has been given to that. The complexity of the challenge, the substance use challenge of the individual will play a role in how long such will be. If the individual does not have so much challenge, then it can be the shortest one, 6 to 8 weeks. Within that, you can be able to sort out most of what is needed, schedule activities, get. But if it's complex, then you might need to do them in phases, and those phases will guide to what you will do, and that can take up to as high as 24 weeks. So it can range from 6 to 24 weeks. That's what I'm just trying to say. And it can even be longer than that, depending on the capacity of the treatment center, the capacity of the provider, the complexity of the challenge that the person who needs the intervention uh, needs. Then the question about a patient who still refuses to engage, who is depressed, and refuse to and if you look at say in activity scheduling, we we don't schedule the activity just arbitrarily. That's why we have to find out what is the value of this person. It is the value that will push, and those are the intangible. It's actually part of how we are trying to explore the intangible rewards of the individual. That this individual doesn't need us to push to this individual is internally because the value is one of the contributors to internal motivation, and that internal motivation, once it's there, the individual will do what you expect to do. So by getting the value of the individual and linking it with the activity the task to do, the individual is likely to do it. But by the time we get the value, we want to link it. We also not make the task complex. We start with the minimum and we move gradually, and that way it helps the individual to engage with it. I'm just trying to look at one of those clinical scenario that a patient is there, and anytime you say come and you say no, I'm not interested in engaging in any activities. I was forced to come for this treatment and I'm here, so that's the only thing I need to do. But by engaging with the individual, interacting with the individual, and the individual will be able to understand the value system of the individual, and that is part of what formulation we do. If I digress, if you remember the presentation by uh, Professor O'Hary, where he talk about the uh, the how the functioning of the mind when they talk about it. And you remember when he started the case, one of the things he also mentioned the value of the person presenting. That value is very good. It is that value that will help us to be able to start as those first things that will make the individual to engage and align. So, like this patient, after interacting and sitting down with the patient, we realize the value of the person. It's not that the person doesn't want treatment, but it just felt that the way and manner of approach of how people will be engaging with him, I will be castigating him, blame him for everything. They don't make him to feel like okay, I've been the black sheep of the family. So let me continue to be. I don't want to change because you people don't believe change is possible for me. You people are not ready to provide the needed change. So by understanding the individual and going deep there to try and get the value, the individual also felt the pain. The existential crisis the individual is also going through, that I even felt I'm a sinner. God will never forgive me because of what I've done, the pain I've caused to many other people. And yet I'm going through this problem. And other people, instead of them to understand this with me, they refuse to. So for them not understanding that with the individual, they refuse to engage. But if you understand it with them, will tell you, sorry, this is a non-judgmental place. This is a place that we want to understand this thing exactly you have talked about that you're feeling. And it is not that you have talked that we understand what is there. And we would like to continue from this by you engaging with us, and that helps us to be able to get the individual, because when we listen to people it also bring out these qualities, this value. It's not just to say okay, I'll be talking and talking or the no, the active listening help to bring out some of this talk out, and from there we get the value and we link the activity with the value. I will make the value simple, simple, not complex first. We make it simple. so that we keep doing. We want to do the simplest thing so that the individual can do it over and over. And it is that simple, do it over and over, that will not help the individual to get it. Because the individual will not see the required mood change. For instance, if it's depression, immediately. It takes time. But if the individual does not engage in that, then it will be difficult for the individual to get the benefit. But it is that engagement that we are working it, and it is we working with the person, because that's part of it, that we are not going to be the one telling that this is what you must do. We will collaborate. So okay, you don't want to do, tell me what you felt is possible for you to do. No, no, tell me. Or every person, okay, now let's look at your day log. Let's look at that's activity monitor, and let's look at your day log. You wake up this time. What do you do when you wake up? Okay, I pray. I brush my teeth. For how long? First 30 minutes, I do that. What do you do after that? I had, okay, I just lie there doing nothing. Or I went to have my breakfast. After that, I dress up. I move to work. I spend also number of time at work. So that is giving you the day activity of the individual. And from there, you'll be able to now get the pattern and be able to analyze, okay, now from this to get, can we increase this one that serve like exercise for you? So that way you are bringing those solutions that, so that, because you are looking for a way to help the individual to go there. And that is why it's not a one size thing. It's a thing that if you don't collaborate with the patient, it will be difficult for the patient to want to engage and to want to improve. I hope this is helpful in a way, and I'm grateful for being given the opportunity to make this little contributions. Thank you.
Thank you very much, Dr. Abiola. You've really made the
Thank you
whole
very much, sir.
discussion today quite exciting and beautiful. So we are 8 minutes beyond our schedule and we should bring the session to an end. But the session is just ending. The live session is ending. The chat session would continue. Please, if you are not in the chat group, you drop a message and Dr. Abiola would note it and include you in the chat group. There's an assignment for two groups of people. If there's a psychologist in our group, let the person prepare a 5 to 10 minutes chat, either chat or a formal presentation next week, Saturday, to let everybody understand the difference between tangible and intangible reinforcements. I think we need that background. So if there's any psychologist or social worker in our group, please feel free to research on these reinforcement measures, tangible and intangible. So that's an assignment for the groups, and would have it we'll have discussions on it. So that's one of the things we're going to talk much about. Yeah. All right. So, Dr.
Sorry,
Bella,
sir.
thank you very much for
Sir, if
leading
I may
beautiful
make,
discussion today.
sorry, sir.
Thanks a lot.
Hello, sir. If
We
I may
also
just,
have had
okay.
people to sign in their polls. I hope we've done that because there are about two people who have not stated anything. And the beautiful thing with online polls is that we know when people logged in. So if you logged in late and you tell us you've been at a particular point, it will just be funny. So let's fill the pool with some level of decency, especially for next time. Yeah, so the rest of the week, there are specific questions. All the questions asked will be transferred to the chat group. Would mention them, list them with the alphabets A, B, C, D, and stuff. So you can refer to the question and make your comments. May I add that the participation in our discussions are going to be rated as part of evidence of progress. So don't just come in and watch and go away. Try to participate because we would know those who participate by how much they have participated, either by asking questions or by answering, either during the session or during the week. So until next week, I'll say bye bye to everybody and we look forward to a more stimulating discussion. Dr. Biola, say thank you for everybody so we can close.
Thank you very much, Prof. Thank you, everyone. And let me plead that please, we should try and type our name into the chat group rather than leaving it as fellow gisters so that you can register our attendance. Please, we should not leave it blank. We should type our name so that each time we are there, it will show our name. Thank you very much. Thank you very much, Prof. Yes, sir.
All right. Thank you.